Hey Mark, do you mind grabbing my glasses? Do you mind grabbing my glasses? Hi everyone, sorry about that. I'm Rendy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, here to give you thank you, our COVID-19 update for Monday, June 29th. I wish I had better news to report on this lovely Monday, but you may have seen in the news some pretty staggering benchmarks occurred over the weekend worldwide. More than 10 million cases of COVID-19 have been documented, with more than 500,000 deaths worldwide. In the United States, the number of confirmed cases of COVID-19 is just over 2.5 million, with 125,000 deaths. And in Alabama, today we see 36,682 confirmed cases with 905 deaths. We may see an increase, a spike tomorrow, because on Saturday there were some problems with processing laboratory results at the state health department. That has been resolved. But again, you may see a spike in the number of cases reported tomorrow after that error is corrected, or that failure is corrected. So again, in Mobile County this morning, we're reporting on 3,502 cases of COVID-19. And just to give you some idea about what happened over the last couple of days and the weekend, on Friday, 104 cases were reported. That was Thursday. On Saturday, 32, and yesterday, 60. So when we look back at the week ending Saturday, 425 new cases of COVID-19 were added, and that is a record high for Mobile County since we began observing cases. Our first was diagnosed on March 19th. So while we had hoped that the safer at home order had allowed us to flatten the curve and maybe stay there, things that have been going on in our community have contributed to widespread community transmission, and we saw the highest number of cases reported in Mobile County in 1 week last week, with 425. That was just over a 41% increase over the week before. We're at 8.3% hospitalized, so around 290 people are known to be hospitalized during their course of illness. 136 have died. That's just under 4%. And the presumed recovered calculation dropped a little bit to 56.5%, or 1,980 cases. If you look at our daily report on a regular basis, in this bottom graph we show the number of cases reported for the last 14 days, with a 7-day and a 14-day moving average. Because of the large increase in the number of cases reported last week, and 2 very large days where we had over 100 cases reported each, our 7 and 14-day averages have moved up substantially. So our 7-day average now is just around 60 cases added on average each day, whereas just 2 weeks ago we were down in the mid to high 30s. So that is troubling news indeed to report to you on this Monday. In addition to the case counts, we continue to see most of the new cases that are added are in the younger age group, so age 19 to 30 or 19 to 40. This is where we're seeing the abundance of community transmission really driving our outbreak. And again, it happens in those people who are more likely to have mild illness or asymptomatic infection. But if you look at figure 3 on our the weekly report, you can see in the blue bars, so the gray bars are cases that are attributed to outbreaks, and the blue bars are attributed to community transmission. And you can see just the enormous growth in the number of cases that occur week by week attributable to community transmission, which for the most part are the younger age groups that are out in the community, going to work, socially gathering, not maybe strictly adhering to the safer at home orders, and putting themselves more at risk of infection. If you are young and you do get infected, it's likely that you will survive and have a fairly mild illness. This is one of the best things about the characteristics of COVID-19 pandemic. But if you are unknowingly infected with COVID and you're around someone that you don't even know has an underlying condition or has an immunocompromised condition, you could unknowingly infect that person and cause them to have severe complications and potentially even death. So this is the reason why we ask you, please wear a face covering when you're out in public. Maintain 6 feet of distance, wash your hands, and stay at home if you're sick. Let's see, the number of cases that are occurring among healthcare workers and residents and employees of long-term care facilities are going down slightly. Again, that's because our general population, 18 to 40, is where we're seeing the dramatic rise in cases. I had been reporting, this is on page 4 of our report, I had been reporting with much delight that for 4 or 5 weeks over end, we had seen a steady decline in the number of COVID patients who were known to be hospitalized or had died. But it ticked up last week compared to the week before. So the number of people admitted to the hospital that we know about last week was twice as many as the week before. Granted, we went from having 4 new hospitalizations to 8 new hospitalizations. That's a small number, but still meaningful. And we added 3 deaths among people who have COVID disease last week. That was up just 1 from the previous week. But I'm really worried about the direction that this seems to be going in, that we have an extreme acceleration of transmission in our community, and there's always a lag of hospitalizations and deaths. And so I'm just watching those figures quite closely to see if they continue to rise or if last week was just an anomaly. I expect that our worst fears will be true. So again, some other stats that we sometimes present on Monday: around 35% of those hospitalized require intensive care, and around 21% require mechanical ventilation. Most people who are hospitalized on average of 9 days, but there is a wide range involved with that calculation. And again, transmission in long-term care facilities accounts for about 60% of all of our deaths, and 95% of patients who died were known to have underlying medical condition. Another sort of difficult indicator from last week, the sort of the culmination of increased transmission in the community and reopening of business. We have at least 1 additional nursing home that's experiencing an outbreak of COVID-19. We know of at least 2 daycares now that are affected, and there are many businesses that we've all been consulting with over the weekend and the beginning of this week who have reopened, had tried to implement safer at home restrictions, were unsuccessful in keeping COVID out of their businesses, and now are faced with potential closures for disinfection or lack of staff to come to work because they're at home and under quarantine. The new figure for this week actually shows community-based transmission for just the last 2 weeks. So these are the zip codes where we have the highest number of cases being transmitted now. So again, we continue to see 36605 be a really high transmission area, and again, that's accounting for the outbreaks that have been going on in long-term care facilities. Next is 36608. Also a high level of new cases reported, and then behind them are 36618 and 09. So if you live at 36606, 36610, so if you live in these zip codes that are shaded towards dark brown, the darker colors mean you have more cases reported in just the last 2 weeks. So we're trying to make that information a little bit more telling about where our transmission is going on geographically. And then lastly, in our weekly report, we talk about the number of tests performed and what percentage of those are positive. We had, again, this last week, even fewer tests performed in Mobile County residents. So, but our percent positive rate rose to 12.5%. So again, not much good news in that weekly report looking back at what we experienced last week. So here are a few media questions. This first one comes from Tyler. So the question is, why has MCHD not issued a health order to make masks mandatory? There are a couple of reasons for that. Last week things were looking pretty good. Yes, we had slightly, slowly increasing transmission, but our number of hospitalizations and deaths continued to go down week after week. And we didn't feel like it was the right time, based on the data, to make masks wearing mandatory. Because if young people can move about safely and not threaten or pass COVID to those vulnerable community members who may suffer severe complications and deaths, then we can continue to allow those activities. But if our community transmission begins to drive hospitalizations and deaths because people are not adhering to the safer at home order when they're out, then we will be forced to consider mandatory masks orders. Now, to your second question, why are the cities thinking about doing this and not the health officer? So what we are talking about is the health officer making a recommendation to the city mayors, and the city mayors implementing the ordinance, because they actually have enforcement authority and the county health department does not. So those are some of the things that go into these discussions, in addition to economics, politics, civil unrest, holidays, social and behavioral health matters. A lot of things go into these conversations. They're not taken lightly, and they're made not just by the health department, but by all of our partners in the Unified Command, looking at the trends of COVID transmission in our community. There are some more things. Let's see. So here's something on the lighter side. So one of our media and communications team said, hey, give a shout out to some of our regular viewers: Phyllis, Melissa, Heather, David, and GLO or Glow. I'm not sure if that's a name or initials. Thank you for watching each day and your help to stop the spread of COVID-19. So someone else on Facebook last week was asking about pool testing. I'm not sure if they're talking about testing swimming pools or if they're talking about testing pooled samples. We don't test swimming pools for COVID. And with regard to pooling, like putting samples together and testing them as a pool, this is often a tactic that we do with screening surveillance. So for example, the blood supply is usually tested by pools, right? They don't test every individual who comes in to donate blood. They will pool blood samples and test them all, and if they find a positive for malaria, let's say, then they will go to all of the patients that are in that pool sample and then try to find out which one has malaria. So this is sometimes done. I've heard in the context of COVID that this might be done with sewage, because there is some viral shedding in sewage, and you may be able to do some pooled sampling. It's basically a sewage system is like a pool of a lot of households, sewage and household waste. So that would be an example of a pooled sample that might tell us something about the prevalence of COVID in the community. So yes, there are some things going on there. If you had something specific in mind, please let us know again. And then someone had a question about herd immunity. This is something that we don't normally talk, and scientists don't usually have to address these things in the public. But herd immunity basically gets to the goal of having enough members of the population protected from a disease through vaccination or through having had it before, and they have built their own immunity. So enough people in the population that are immune to the disease that if it gets introduced, that we who are immune protect those who are not immune. So basically the herd of people protects those individuals in the herd that are vulnerable to infection. So if I need to do a better job on that another day, they'll let me know, right? Okay, let's see. Here is a question that I wanted to answer. Should all restaurant workers wear a mask? That is not the mandate. The mandate, the health order says all healthcare workers who interact with members of the public shall wear a face mask. That is the mandate. So if you go into a restaurant or a fast food facility and everyone in the restaurant doesn't necessarily need to be wearing masks, but the ones who interact with members of the public do. And if the restaurant workers cannot maintain 6-foot physical distance, let's say in a kitchen, then they should also wear a mask. So I hope that clears that up. Already answered that one. Here were some comments from Dr. Eischold with the question about issuing the health authority, and I seem to have lost Stephanie's comments. Mark, we'll have to do that again tomorrow. It's okay, we'll address it tomorrow. Okay, let's see. What kind of hospitalization increases has Mobile seen since last week? Are there any concerns about capacity limitations for hospital bed? Are there enough ventilators? Yes, we have seen a slight increase in the number of new hospitalizations. We have also seen an increase in the number of people hospitalized at any given time. In the last couple of, like last week, early in the week, and the week before that, we were seeing on average in the mid-50s of people hospitalized on any given day in the county with COVID. And this week it's gone up into the mid-60s. But yes, we currently do not have a shortage on beds or ventilators. What is my opinion about Mobile's potential mask ordinance that's going to be voted on tomorrow by the city council? Again, I think we'll wait and see, but with the numbers having jumped up like they did last week, I expect that will weigh heavily on the minds of your policymakers in making that decision. And it won't be just one mayor making that decision, but we are hopeful that all of the mayors will, involved in our unified command will consider the information from last week, the guidance from the recommendations from our state health officer, and make good decisions for their community. Let's see. After watching the press conference, thank you, with State Superintendent Dr. Eric Mackey and Dr. Scott Harris, parents were still questioning what the plans would be for Mobile. Everybody's questioning what the plans are going to be everywhere. It's not just Mobile. So that 50-ish page document was published on Friday. My boss, Dr. Stephanie Woods Crawford, and her team, our inspection services team, are trying to digest that volume of information, identify where there are, opportunities for public health to advise the local jurisdictions. Dr. Crawford is inviting superintendents and universities and colleges to talk with the health department to try to, see how we might be able to help them, but also let them talk to one another. So hopefully we can have some consistencies across the jurisdiction. Let's see, lots of questions about what's happening in schools, and it's really just too early to tell. The health department can make some recommendations, but we do not make orders about what happens in schools. Those are done by school boards. All right, with Florida suspending on-site consumption of alcohols at bars today, I think that was Friday, should Alabama do the same to help stop the spread of COVID-19? It's on the table, it's possible. We have said all along that as this outbreak continues, there will be tightening of restrictions and loosening of restrictions. And this is going to happen in phases, probably for months. So I anticipate that if we continue to see a 40% increase week over week in COVID-19, you bet that some restrictions are going to go back in place. But again, those would be made most likely at the state level, not at the local health department level. Let's see. If someone tests negative but has COVID symptoms, should they still quarantine for 14 days? Yes. If you have symptoms of COVID, you should be in isolation, even if you test negative. There are other reasons for having a negative test. You may have another coronavirus, you may have another upper respiratory system, but it's 2 negative tests that say that you don't have coronavirus. And still, if you're symptomatic, you should stay home because you have something, and we don't want you giving it to somebody else. Let's see more about the state superintendent, so please ask them. Lots of people have, last week we released well, it wasn't hidden, but we just said on Facebook, and then we put it on our Facebook, that if you have if you observe that a business is violating the Safer at Home order, that you can send a message to iscomplaints@mchd.org, and we will at least call the facility or the establishment and talk with them to make, just from a point of informing and educating, to make sure they know about the order, that they understand it. And then if there are continuous reports, that we would make a site visit and potentially issue a violation. But the first day, I think after I said that online, and you probably posted it online, we got 25 emails that first day, and those emails had not stopped coming in. We are getting inundated with people willing to let us know, observers, our community partners that are out there informing us when there are people not adhering to those Safer at Home orders. So keep it up, and we will try to make calls to those establishments to the greatest extent possible with the team that we have. All right, let's see. Let's switch down to some of these Facebook. Why does the local report, the patient characteristics data, report numbers lower for our area than national reports do for Mobile County? So this is something that happens with every natural disaster, every outbreak. There are so many different people clamoring to report numbers on the number who have been injured or who have died or who got infected or who got tested. And those reports coming from all different, tons of different locations will never add up. So I don't know where some of the national, like where Johns Hopkins gets their numbers for Mobile County, I don't know. I know that the state, our numbers are very closely aligned with the state health department, though they are sometimes not perfect. And we report data directly to the Centers for Disease Control. So where some of these, like CNN has got a gorgeous dashboard on Mobile County data. And I go there sometimes and look for things that I don't have access to myself. So some of it is administrative data, some of it is advertised. I don't know where it comes from, but it doesn't come from us. Once you have COVID-19, can you get it again? The science is still out on that. I've mentioned before that the immune response that is mounted when an individual is infected with COVID is still being examined and studied and understood. And right now, it's too early to say how long those antibodies might last, or how well they might protect you on a second time of being infected with the virus. Let's see. If you have a family member who is immunocompromised, should you consider gaming your child to virtual school? So, returning to the classroom is going to be a very personal decision for a lot of people. It's right now, it's the same decision and very personal family decision as to whether or not they put their children into daycare, because we know that children can carry virus. We know that they most of the time have mild or asymptomatic infection, and we know that they can potentially transmit, or they can transmit, virus to, their grandparents or their aunts and uncles, or people unknowingly transmit it to people who are around them who are immunocompromised. So if you have a household that has an immunocompromised individual and you're contemplating sending them back to school, that is a very personal decision that we are very happy to talk that through with you. But it really depends on things like, do you have alternative care? Can you separate, your immunocompromised family member so that they maybe sleep in a separate part of the house or have a separate bathroom? How is your health care? Do you have health insurance so that you can get the best care for yourself and your family should your immunocompromised family member become ill? I mean, these are difficult decisions. They're not easy. And I believe that the superintendent's advice about, safely reopening schools, or the roadmap for reopening schools, has considerations in there should people decide that they do not want their children to return to campus for fear of bringing COVID into their house. So certainly that is something that you'll have to consider very carefully. So I think that is going to be it for today. All right. So WIC, thank you. So our women, infants, and children's services will remain the same through the end of July. Just wanted to make sure everyone knows that there will be no change in how you access WIC services and benefits through at least through the end of July. So things will stay the same in that regard. All right, thank you very much, and we'll talk to you again tomorrow.